Joe 200, how are you? It's November 13th. It's Tuesday, the week before Thanksgiving break, which gives you a little break in Joe 200 as well, which is awesome. However, I think it would be a great time if you're going home to see your parents, maybe your grandparents, um, to have a little town meeting, a little family meeting about some fairly serious things that go on with aging. And it's the topic of this week's readings and quizzes. Okay. In addition, no better time than to interview somebody. And so we have that coming up right here, the final interview paper that is due December 5th. So here's your chance to get to know your parents or your grandparents in a way that you never knew them before. And I promise you, you will find this incredibly rewarding. Okay. Don't forget when you come in here to the paper, we scroll down to the bottom, okay? And just like all the critical thinking assignment, now this is worth, of course, a lot more than the CTs. You'll see that we have a whole bunch of instructions here that for you to follow. So you just follow through the instructions, okay? You can design your own questions. These are really great example questions. And again, you just what you do is you give a little biography of who they are. Okay, you address the issues as indicated by these questions. Okay, and you lay out their responses, and then the key part is you do an analysis with citations. Okay. And again, we're looking for the at the very end, a bibliography with those list of citations. Okay, how many citations? 10 outside references. You do not reference this course. You go outside this course and Google Scholar or whatever, and you find references that support it. Okay, it's a paper. Alrighty, so that's part one. All right, so awesome. I can't wait to see your guys' papers because you know what? Every single semester, people get really personal and it's really awesome, and they consistently tell us how awesome it was for them to get to know their parents or grandparents in this newfound way. Okay, so that's part one. Part two, we look at the readings, courses, and quizzes. We scroll down here to the last 2 weeks. Okay, so we see that we have the 12th. Okay, and then we have right here the 19th. Okay, and we notice that that the final week does not have something. All right, so that's awesome. I'm checking my calendar here. Okay, so what we have right here, okay, is the first legal aspect of this course, and that's the durable power of attorney, health, okay, and also living wills. So what these things are called an advanced care directive. And this is a whole sheet that the NIH and the National Institute of Aging, NIA, provide as just kind of a guideline for preparing your advanced care planning. Okay. All right. So this advanced directive is a legal document that healthcare providers have to follow, and that's crucial. And so is this important to you? Well, it's all about what you want to be done under conditions of crisis in healthcare. Okay, and things like do you want to have heroic efforts done to keep you alive? Okay, um, artificial mechanical uses like CPR. Okay, ventilators. Do you want to be kept alive with artificial nutrition and hydration? Are you opting for comfort care? All right. These are all important issues. Okay. This concept of ventilator use and artificial nutrition, you can be brain dead and be kept alive for a long, long time with these. Is that what you want? Okay. Do you view when your time has come, your time has come, and you don't want to be resuscitated? These are all personal decisions that you have the right to, as an individual, to make a decision on. Okay. So these short paragraphs here go through what CPR is all about, what the ventilator use is all about, what artificial nutrition and hydration is all about. Okay, I had to go through both of these with my father and my mother in terms of decision making. Okay, comfort care. Okay, we'll go into two different aspects here. So we have what's called hospice care, and then with the second one is called palliative care. Okay, what are the difference between these? Well, hospice care is end of life care. Okay, It's really intended to make you as comfortable as possible with the drugs that are currently available. Um, these are usually opiate drugs, okay? And the morphine will reduce the pain and discomfort um, during what is predicted to be your last month of life or the last couple of weeks of life, okay? And the doctors provide you with the morphine, and the hospice agent, which could be you, then is in charge of administering the opiates. So these are pretty big deals. Okay, palliative care is again providing similar types of treatment. However, this is to make somebody comfortable during actual medical treatment. So this is kind of stuff cancer patients oftentimes the pain of chemotherapy, radiation therapy. Um, we may in addition provide some of the comfort care that you see in hospice care. So those are the two differences there. Okay, so getting started here, you have to think about all the different types of interventions that you want to have done, and this is all through here. Okay, if you have a stroke and it leaves you paralyzed and your heart stops, do you want CPR? You have to lay all of this out in a legal document. You have to be very clear. What if you have dementia? Okay, you don't recognize family members, friends. Okay, you can't feed yourself. You still want to be tube fed. Okay, do you want to be kept alive, or would you rather allow yourself to be put into this situation with hospice care? Okay, all these kind of decisions have to be laid out in a document. Okay, or it's outside your ability to make those kind of decisions. Okay. Alrighty, so again, this goes through the things like the Do Not Resuscitate Act, and then if you do die, are you going to be a donor? Okay, are you willing to donate your things? Now, this may seem crazy because you're looking at somebody, your grandfather that's 90 years of age, but this very document is something that you need to have filled out for you in your 20s. Okay, because you have to ask yourself, if you're a brain dead, do you want to be kept alive? If not, are you a donor? Okay, it's a really important types of decisions. Okay, alrighty. Now, as we go through this, you're going to have to, decide if you go for a durable power of attorney health care plan, okay, versus a living will. You have to choose your proxy. Okay, so for my mother, I was the proxy. I was the decision maker. Now we discuss things in advance, and you can have a living will in advance that can guide the attorney in fact, which was me, or the proxy, to make the decisions of healthcare as they come down the pike when you're the person you're caring for is in the hospital. Okay, alrighty. It's best to be a family member. It could be a friend. It could be anybody that you want it to be. It's your choice to decide who that proxy is going to be, or attorney in fact. Okay, and you can decide how much leeway they have, how much responsibility they have. Okay, alrighty. In terms of making it official, you have to find out what is the legal aspect in your state. So it's a state thing, okay? The state of California has its own form that is easily filled out, okay? All righty. This is something that you would be carrying around in your wallet that directs a healthcare operator in an emergency. Who the proxy is if you use durable power of attorney health, and do understand that you do have the option also of doing a living will, and they can run in parallel. Okay, the dating of the document, okay, is the most important thing. Okay, so legally, whatever has the most recent date is what has precedence. Okay, so but the living will is a document that you can have available. Okay, can be presented to the healthcare practitioners and tell them what it is you want to do without having a durable power of attorney. You can have a durable power of attorney because sometimes things that you might predict to happen that you write up in terms of what your needs are in the living will could change. Okay, but maybe you're incapacitated, and that's where the durable power of attorney health care would be able to interpret things kind of online as things are changing. All right. Okay. So that's what this is all about. Okay. And if we come over here, okay, and we see California. God, I cannot type tonight. Okay, California. Advanced directive forms. Okay. Alrighty, and so these are a bunch of the different advanced directive forms. Okay, and you can just download these things. Okay. There's also a form that can just be filled in. Okay, and all right, let's see if I can find that. Jeez. All right, so here's an E form right here. Okay, so you just go like this. All right, and you create the document right there. Okay, and so that's how you do it. And when you click on this, it goes create document, and it just fills things in for you. And you just advance along as you're filling out the form. Okay, and I just wanted to show you that. Okay, and remember, I got that by doing California Durable Power of Attorney forms. This is something you can do for every state that you live in. Okay. It again applies for the state you live in. So if you're frequenting multiple places, multiple states, then you have to have them set up for each state. Okay. All right. So that's what this is all about, and the quiz will be looking over that. If we go into the discussions, okay. This week's discussion has to do with kind of cultural diversity and care, and this also applies for that. Okay, every culture has a different view of end-of-life care. Okay, and being sensitive to that is empowering. Okay, and that's so. This is what this is all about here. We actually have some students that are business majors / gerontology majors, and as they are developing their assisted living facilities, they are catering it towards the needs of different cultures, and because every culture is different in terms of how they want things to be handled, and so it's kind of an eye opener, and it's really useful if you're an attorney and you're responsible for setting up these advanced directives. Understanding the differences in cultures is a very useful entity. All right, so that's what this is all about right here. Okay, so that is it. Okay, and so I want you guys to kind of think about this when you go home for Thanksgiving. The other thing, we've kind of set it up for the following week, so it's the same kind of concept. So you're going to talk to your parents about advanced care directives health, and then when you come over here, the last thing we're going to do here is we're doing a financial power of attorney. Okay, and this is a really simple document, and it's again super important. You know, if your parents become incapacitated, you want to have on file the legal document, okay, which is the financial power of attorney that says that you can now take over the care of their finances. Okay, this would include being able to access their bank accounts and pay their mortgage, access their bank accounts and pay for insurance, access their bank accounts and pay for their car payment, whatever it is that needs to be done. Okay, you then have the appropriate legal document that allows you to take things over. Or maybe the person is becoming demented, okay, and you know that, and so you would have to then legally find out if the person no longer has the capacity, and that's a key legal term, to make good financial decisions. And then if that's the case, then again you can get in there and seize authority so that you can make sound financial decisions for them. And that's important because there are many criminals out there that seek out people that have capacity issues, and they will take advantage of them financially. All right, so that is it for this week, and we'll see you next time.